as being a place teeming with activity and people. So upon arriving here, I expected the same, forgetting that we are in the pandemic era and things have changed. Anyway, we're here today because we also want to commemorate a very important event in our calendar that we are kicking off today, and this is the World Blood Donor Day, which is going to be on Sunday, this Sunday, but we have already begun the campaign, and this is part of that campaign. So we are here today to bring support to our national blood transfusion services, and also to remind ourselves that although as a ministry we have been focusing over the last 3 months or so mostly on coronavirus, as a ministry we have a much larger mandate and a much larger responsibility to the citizens of this country in ensuring that we are able to provide the necessary services for health care. Blood, of course, is a very important component for health care, and I'm very happy that today we are here to launch off this blood donation campaign. This event is to mark, as I said earlier, the commencement of the blood donation campaign as we prepare for the World Blood Donor Day, which will be commemorated on Sunday, 14th June 2020. We are, as a country, with our population of approximately 50 million, the WHO recommendations for the level of blood that we should be stocking or collecting within a year, at a minimum, is 1% of our population. That is around 500,000 pints of blood a year. That translates to collecting about 1,370 pints of blood every day for us to have sufficient stocks of blood to last us for a year, according to the minimum amount that we must have. However, we have had challenges in our blood collection, and we have been recording about a collection of about 164,000 pints a year over the last couple of years, which translates to around 450 pints a day. So you can see we are far short of the minimum that we should be doing, and there is a need for us to work towards achieving that minimum. With the COVID pandemic, as has been seen globally in many other areas, many other parts of the world, because of the restrictions and the containment measures that have been put in place to combat COVID-19, it has been recorded that those seeking health care have also gone down. The rate of people going to hospitals for care and for other services has gone down because of this abnormal situation. And this is something that is not unique to our country, but has been recorded everywhere else. If we look at blood collection during this period of the pandemic, it is estimated that between 70 and 80%, there has been in blood collection during this pandemic year of the world. We in Kenya have recorded 450 pints a day to about 250 pints a day. So the launch campaign is extremely important because we need to increase the number of pints that we collect in a day. And you all are very well aware that we have faced challenges as far as our national blood challenge is that as a ministry, in order to improve service delivery in this sector, recognizing the need for in this sector, the government has initiated a number of programs to be able to build up the capacity of the Kenya National Blood Transfusion Services. We have increased the number of human resources within this facility by posting an additional 22 members of staff to the Kenya National Blood Transfusion Services. We have also arranged for additional resourcing of this facility, and we will be pumping in about 1 billion Kenya shillings through a World Bank program in the coming months to upgrade and improve the level of services, the level of blood collection within all the satellite sites and sites that collect blood under the Kenya National Blood Transfusion Services throughout the country, to ensure that we have enough commodities that are required for blood collection, that is the blood bags, and everything else that is required for that supply chain, and also to ensure that we have the right equipment and reagents that are required in the lab to ensure that the blood we collect is properly handled, processed, and is safe for transfusion to patients. So that is ongoing work, and we, including, as I should add to, including looking at the governance structure of this very important service sector with a view of improving that through legislation so that the National Blood Transfusion Services can become a semi-autonomous agency that will be able to function with some level of autonomy and hopefully effectiveness and efficiency. These are all plans that are in the works, and I'm sure that in the next coming months we should see some activities in that area, even though the COVID-19 pandemic situation, of course, as you will all agree, has slowed down a number of activities. So, ladies and gentlemen, as part of effort to appeal to our people to volunteer and donate blood, we have also collaborated with partners leveraging on the importance and utility of ICT in service delivery. We have collaborated with Facebook, for example, and Dawa Sasa Systems, who use their ICT platforms to mobilize blood donors for the next 2 blood donors for blood donation campaigns such as this one. For this particular campaign, I can tell you that as of this morning, about 12,779 individuals in the country had set reminders on their Facebook accounts to come out and donate blood countrywide. There are also 33 other centers countrywide where this same exercise that we are conducting here today is also being carried out. Another 1,522 people who have called various centers to book an appointment for blood donation are expected also to present themselves and donate blood at these centers. We want to appeal to those inquiring and making pledges, as well as other well-wishers, to come forward and participate in this very important activity. Must also acknowledge, say that we are grateful to our partners and sponsors who have extended their hand of support in this venture. We want to express our appreciation to the Kenyatta International Conference Center management team for allowing us to use these wonderful grounds for this campaign, the Standard Group, Dawa Sasa Systems, UNFPA, AMREF, Farm Access, Kenyatta National Hospital, and Coca-Cola, who have all played a part in organizing this drive. Let me now move to our business of the day, which is to bring to you our report on COVID-19. Ladies and gentlemen, I am delighted to inform you that today we have discharged 72 patients from various hospitals who have recovered from the disease. This brings to 1,164 the total number of those who have so far recovered from COVID-19. This is good news. I think every time we see good numbers of recoveries, it's good news for us because it shows the balance between those that we are confirming positive and those that we are discharging. Remember that this is an in and out process, so the more we discharge, the more we will be able to handle as if our numbers rise. But it is also a clear indication that COVID-19 disease is not a death sentence. You can get COVID-19, you can recover, and you can move on with your life. To overcome this disease, it is very clear that we have to follow and adhere to the advice that is issued by the Ministry of Health. As we have said repeatedly, to beat coronavirus or COVID-19 disease, we need to be able to contain it, and the containment measures of hand washing, social and physical distancing, wearing masks, avoiding large gatherings, staying at home when you can, and minimizing any situation where you will be interacting with others. Those are the key measures that need to be observed in order to break the cycle of spread of this virus. Now, when we come to testing, today we have tested 2,000, over the last 24 hours, 2,419 samples, bringing to a total the number of tests that we have so far conducted to 108,666. Of these 2,419 samples tested over the past 24 hours, 90 have returned positive for the virus. And this number now brings the total number of COVID-19 positive persons cumulatively to 3,305. All the positive cases are Kenyans. 62 of them are males and 28 are females. The youngest is 14 years old and the oldest is 80 years old. These 90 cases are distributed in the following counties. Nairobi recorded 36, Mombasa 34, Busia 12, Uasin Gishu 3, Kilifi, Garissa, Kisumu, Meru and Turkana 1 each. By sub-counties, the Nairobi cases are from the following areas: Kibra 12, Makadara and Mathare 5 cases each, Kamkunji 4, Langata 3, Westlands and Embakasi Central 2 each, Dagoretti North, Embakasi West and Embakasi South 1 each. In Mombasa, the 34 cases are from Mvita 14, Kisauni 8, Likoni, Jomvu, Changamwe 4 cases each. In Busia, all the 12 cases are of truck drivers at the Malaba border point. Garissa's 1 case is from Garissa Township. Kilifi's 1 case is from Kilifi North, and Kisumu's 1 case is from Kisumu Central. Meru had one case from Imenti Central, and Turkana, one case from Turkana West. Unfortunately, we have also lost 4 people from the disease, which now brings the total number of people who have succumbed to this disease to date to 96. We send our heartfelt condolences to the families and friends of the departed. As I conclude, I want to extend my appreciation to all individuals, groups, and companies that have partnered with the Kenya National Blood Transfusion Services in this campaign. Once again, I want to appeal to all Kenyans to come out in large numbers and donate blood in order to save lives of others. Finally, I want to remind Kenyans that we must strictly observe the COVID-19 containment measures because they are the only known modes of behavior to successfully fight the virus. And as I finish, I would also want to urge those of us who are here, including my entire team, that we support this campaign by walking over to the tents when we finish and donating blood. Thank you.
Okay. My name is Chemtai, going from Citizen TV. I have 2 questions. One regarding, of course, what you've spoken about, blood donation. There's a lot of perceived politics, blood politics. Some people go to hospitals and are forced to part with money before getting blood. First, address that matter, and possibly what are you doing to change the attitude of Kenyans who prefer to wait until they have a relative in hospital to give blood than just give willingly? And just a clarification, after the extension of curfew from 7 p.m. to 9 p.m., what does this portend for restaurants which were supposed to close at 4 p.m.? There's a lot of, there's some that are opening late into the night. That matter is not clear. Thank you.
My name is Purity Musa from KBC on the home-based care program for COVID-19 launched on Wednesday. Do we have so far any patients that you've released that are positive cases that you've released and are under this program between Wednesday and today?
My name is Helen Aura from NTV, still in the home care, home. Just a clarity, will they be done, or will they be just healthcare volunteers who will be deployed to the homes? And what parameters will you put in place to also ensure that these same home care-based workers will be safe also from preventing this contraction of the virus? My second question is, NTV had reported a memo regarding the transfer of some workers within the ministry, or even just the health ministry at large. And it came to note that some of this transfers, some of these officials refused to be transferred. What is the ministry doing regarding this particular matter?
Okay, thank you. Chemtai, I think what you in a different way is that, and we have seen it in the media on several occasions, that there is some level of possibly corruption, as you may call it, within the services or blood services. A number of issues, of course, have been out there in the media regarding the operations of the National Blood Transfusion Services. These are issues that have been brought to the attention of the ministry, and I think all of you are aware that there are some processes that are ongoing right now. Even as we speak, there are investigations that are being undertaken to try to establish exactly what is happening or what the veracity of some of these issues are. So I think we are also, as a ministry, very eagerly waiting to see what is unearthed. But clearly, as I had said, we, as a ministry, are moving forward in a program of reform of the Kenya national blood transfusion services. Those reforms are going to be widespread, including looking at the legal structure, as I mentioned, but also focusing very strongly on governance and leadership issues. So as this information becomes availed, I'm sure we will be able to share it with you. The intention here is if there are any problems in the system, we need to clean it up, and we need to make sure that that facility functions the way it was intended to and provides the services that it is required to provide. The attitude of Kenyans in terms of coming out to give blood. We have repeatedly said, even in this COVID-19 campaign that we are conducting, that matters health touch on each and every one of us. Even though we may not be affected, they will touch us. The COVID-19 touches each and every one of us because we are all at risk. And that is why we keep saying that we must be each other's keeper. And we must take responsibility as Kenyans. We must take responsibility to take charge of our health and the health of others by protecting ourselves and protecting others. When it comes to blood, again, that responsibility and that desire to do common good, the compassion that is within us, we must light that up so that we are able to care about others, to be able, those of us who are able to provide, we do so. Blood doesn't cost much to give. It is a biological component of our bodies, but it is replaced very fast. A great deal from anyone other than the time that you take to be able to draw out that 1 pint of blood. Voluntarily. So we need to come out voluntarily and give out that blood. How then do we also reach out to people to come out? Well, as I said earlier, we need to look deeper and see what are the things that we can do that or inspire people to come and donate blood. As we said, we are now going to be working using ICT platforms. Facebook is one of those groups that to come and donate blood, not only during campaigns but at any particular time, because they have the Facebook page and they are sent reminders. Population sensitized, particularly as media too. I think you too have a responsibility. And I'm also appealing to you to use your platforms, to be able to get people to understand what it means to give blood. That blood can save lives. Curfew times. Chimtai, I think what you are asking is now that the curfew time has been, at least the curfew begin time has been pushed to 9 p.m., does that also mean that the time restaurants close has been extended? I would imagine that is natural, that probably happens, although we may not have we may not have stated it clearly, but I think Dr. Kuria can talk on that. Home-based care. Whether we have, since we launched the guidelines for home-based care, which was on today's Thursday. That was on Tuesday, so it's only 2 days away. What is our experience so far? Let me allow also Dr. Kuria to respond to that question. Helen, home-based care too. Your question was particularly about the healthcare workers who are taking care of the home-based clients. There are several tiers of care that are provided to home-based cares. Of course, when you put somebody who is asymptomatic, does not show any symptoms, has not progressed to a point where they are beginning to show symptoms, they can be adequately taken care of even by a member of the household. And if you recall, we said that within the guidelines, there will be provision that people within the household, a caregiver in the household, could be appropriately trained in terms of the protective mechanisms that they use to be able to take care of that individual. If that individual, from monitoring by this caregiver, indicates that there is progression of that the individual is beginning to show symptoms, then that is at the time when a healthcare worker, a qualified healthcare worker, will come in and assess the situation. As we said, the guidelines also has provision that if an individual who is on home-based care develops symptoms and requires to be hospitalized, that there is a referral system for doing that very rapidly. So those measures, those arrangements have been put in place to ensure that that can be done. We also talked about community isolation, if you remember, and we talked about community health volunteers. Community health volunteers are actually trained in many, many modules on health, on how to deal with health at the community level. They will be a part of this home-based care, and a module has actually been developed to train them, and they have been trained on COVID-19 and how to take care of COVID-19 patients or COVID-19 positive patients within their home settings. Then the last question was regarding the issue that the CS talked about in terms of human resources and certain difficulties of moving people once they are posted. You know, we live in a liberal democratic society, and people have their rights, and some people may decide to exercise their rights and move to different places to go and try to ensure that they are able to exercise those rights, and that they may not move if, for instance, they have been requested to move. We know cases where people have gone to court to get injunctions to prevent them from moving there. This is a broad issue that I think needs to be addressed, because in the public service, once you are employed, there is a provision within the appointment letter that gives the authorities within the ministry the leeway to be able to post people to different places as they deem it necessary. So there is that fundamental issue that needs to be looked at. And this is being discussed at those levels. And then, of course, there is a course of action, or disciplinary course of action, that can also be applied. I think all of these are being looked at as far as human resources and how to discipline and work with human resources is concerned. Let me allow Dr. Kuria now. You can see it's about to pour and we need to donate blood. Let me ask Dr. Kuria to say a word or two, and then I think we can all, including you, go in there and maybe each one of us give a pint of blood.
Thank you, Dr. Rashid. Chemtai, it was your question on restaurants operating beyond the curfew times. Thank you for your concern, and we wish every other Kenyan would be concerned like you. It is very concerning, actually. I was actually very concerned last weekend because I saw it myself. That the minute curfew was extended to 9 p.m., most restaurants extended their times to 10 p.m. And the activities in those restaurants were not what we anticipated the restaurants were going to be doing, serving food, but indeed are serving alcohol. It's rather unfortunate. And although it has not been announced about the extension of restaurant operating times, I think His Excellency the President extended curfew time to give more time to those who want to do meaningful business do it. And as a ministry, we are reviewing the protocols in use for the operation of eateries and restaurants, and the reviewed protocols that are going to review those timings upwards are also in progress, and they'll be released to the public in due course. I'm sure they are going through the final approval stages. But before they are approved, we urge Kenyans to again be responsible. Please close your restaurant at 4 p.m. as required by law. And we have instructed law enforcement officers to purge on those who are disobeying this. And it has already happened in a few of them. And as we said when we were launching the protocols, if we withdraw your permit, it is withdrawn permanently. So if your permit has been taken, don't bother reapplying. We will make sure it will not go through. So avoid enforcement officers purging on you because you're not obeying the times that were given. They will be reviewed, and if curfew has been reviewed upward, I'm sure even this is going to be reviewed, and the whole country will be opened up for economy. So we urge all those who are running restaurants to keep to the timings. It is still 4 p.m., so that will give the restaurant workers time to go home and beat the curfew still. Allow me also to talk about a few who are also flouting other rules of social distancing, especially in funerals. We've noted with concern again, we've gone back to our old times as though COVID has stopped. So although curfew has been lifted again, or has been extended, we have not extended our social distancing measures. They remain the same, and we are still again urged that for those attending burials, the requirement is that let not more than 15 people be in attendance. Again, we are working with law enforcement officers to enforce this. And as I say, and I keep saying, we shall not relent on those who break the law. So be on the lookout, because they are there and they are also watching. Alongside that, there was a question on any patients who have been on home-based care that have been discharged, purity. Yes, before home-based care protocols were launched, there was a pilot already being undertaken involving about 299 patients on home-based isolation and about 15 mothers who are breastfeeding. I'm happy to report today, yes, about 208 of them have been released from home-based care back to the society. They are safe, and they can interact with you. There's no need for stigmatization. They are as good as you are. So, yes, it's a success story that home-based care protocols can indeed work. Thank you.
Yeah, we go for... Where's the